Rochelle from BSN 2A Group 2, and today I'm going to demonstrate the Perilite Exposure. And the purposes of this is Perilite Exposure is the application of dry heat to the perineum or perineal area to provide comfort and also for increasing the blood circulation and hasten the wound healing by means of using a Perilite or perineal lump. And now let's proceed for the preparation. So first is the assessment. So first we need to assess our patient or check the patient's condition before doing the procedure or applying the procedure. And for the planning, we need to prepare and gather all the equipment that we need. So first we need, here is the perineal lump or perilite. And actually this is not the actual perilite. Maybe in the hospital it is available, but let's say for instance this is a perilite or perineal lump, and then we need also a blanket, and also we need a perineal flushing set. Actually there is a set or a perineal flushing set wherein all the equipment that we need is in a container, but as I don't have that, I just prepared all the equipment that we need. So I have here a kidney shaped basin, and also the Kelly's or forceps, and also a cloth, and also you can use a sterile gloves or a clean gloves, and also I have here the wet cotton balls and alcohol, and also a water. So those are the materials or equipment that we need. And then you need to check the electrical equipment for any defects or try to switch it on and off. So our electrical equipment is in a good condition. And also make sure or always remember that you need to make sure that your hands is dry when you are handling an equipment. Then now let's proceed for the implementation. So for the implementation, first thing you need to do is to check the physician's order for each area to be treated and also the duration of the therapy. And then you need to identify your client and introduce yourself. So by identifying your client, you need to do is to check the wrist tag or the name tag, and also ask the full name and the birth date of your patient or client, and then introduce yourself. So let's say for instance, she said her name is Sophie. So hi Ma'am Sophie, I'm Rochelle, I'm your nurse for the day. And then you need to explain what you are going to do, why it is necessary, and how our patient or client can cooperate with us. So, Ma'am, I'm going to do a Perilite exposure. It can help your wound in your perineal area or perineum to be healed. Not so fast, but as fast as possible. So the Perilite can help your wound to be healed. So as you signed in our consent paper a while ago, you are allowing me to do this procedure. So as I am doing this procedure, I need you to cooperate with me. So I hope you can cooperate with me. Then after you explain everything to your patient and you gain their trust, now you need to perform a hand washing or a you can use, actually it would be better, I mean, that you wash your hands, but I prefer here to use a alcohol, and you can also use a sanitizer. And then do other appropriate infection control procedure by putting a gloves. I said you can use a sterile gloves. So let's just use this sterile gloves. Now I put my gloves on, the sterile gloves. Now you need to provide the privacy of your client. So by doing that, if you're in the room, make sure that you close the door and also the window. And if there's a curtain, you need to close the curtain. And the only area to be exposed is the area to be treated of your patient. And then you need to have an adequate lighting. So as I am in my room, I have my daylight, and also I switch on my light in my room. And then you need to render flushing render flushing the perineum or render flushing the perineal area. So we need to expose the area and then get the bedpan. So let's say for instance this is the bedpan. Actually, then you need to get the forceps and then get a cotton balls, wet cotton balls, and then discard it, and then you need to have the water, and then you need to dry thoroughly the perineal area, and then remove the bedpan. Sorry. And then you need to make sure that it is dry. Then after cleaning the perineal area, perineum area of your patient, now you can place or help the patient in a lithotomy position. Actually, I'm not sure what is the material that the hospital is using for lithotomy position, but as of now, I'm going to use this. So, and then get the blanket and cover your patient. And then you need to you can now put the perilite or perineal area under the blanket. So switch it on. So let's switch it on. This for about 18 to 24 inches away from the perineal or perineum. And for us to avoid not to burning our patient. And then put your gloves, remove your gloves and discard it, and then now you can assess your patient then you can actually say to your patient not to change the position during the entire procedure, and nor not to touch the lung. So you can leave, and then you need to assess your patient for regular regular assessment. So by doing that, you need to check for any discomfort, and also if there's a burning reaction or a untoward reaction. Then you can leave, and then you can check, and then after 15 minutes you can now remove the perilite or perineal lump, or as the physician's order. Put this on, and then you need to check for any untoward reaction. And after checking everything to your patient, you can now place the patient in a comfortable position. So help your patient. So sir, I'm going to put this equipment out, and then I'm going to help you to a comfortable position. So sir, do you feel comfortable? Are you comfortable? As the patient said, yes. Now, you can document all the findings that you get in the patient's record using a form or checklist supplemented with a narrative report when appropriate. And then you need to check the equipments that you use. So for a regular basis, because that will be used for another patient or other patient. Then now you need to return all the equipments that you use. So let's say for instance all the equipments that I use is now in their proper places in the storage room or storage area. Then now let's proceed for the the evaluation. So for the evaluation, you need to do a follow-up based on the findings that deviated to the expected or to the normal for the patient, and then you can now relate it to the previous data if it is available, and you need to report any deviation from the normal to the primary care provider.